welcome to Empower Migra.
Thanks for having me. It is great to be here for this deep dive.
We are taking a really close look at scientific studies on migration, integration, and discrimination.
Right.
But we are doing it without all that dense academic jargon.
Right. Nobody wants to listen to a textbook. We want to know what the research actually says in the real world.
Exactly. Because what the data says often completely contradicts what many of us just assume to be true.
Oh, absolutely. The baseline assumptions we make about our institutions are often just, well, they're wrong.
Which brings us to today's deep dive. We have a specific stack of sources, primarily a 2022 peer-reviewed study from the journal Healthcare.
Yeah, the title is Foreign Healthcare Professionals in Germany, a questionnaire survey evaluating discrimination experiences and equal treatment at 2 large university hospitals.
Okay, let's unpack this. Yeah. Because that title is very academic. But the human element of this research is, it's something we designed this specific deep dive for you, the listener, to really wrap your head around.
We want to bypass the information overload and get straight to the aha moments.
Right. So before we jump into the hospital wards, we need to set the baseline. The study talks a lot about this German concept of migration background.
Yes, the migrations Hintergrund. It is a massive societal category. We are talking about roughly 21.2 million people in Germany.
Wait, really? Like a quarter of the entire population?
Exactly, about a quarter. And it's a very specific statistical label. It is based historically on citizenship and blood ties.
So it's not just someone who moved to Germany last year?
No, not at all. It stems from the principle of jus sanguinis, or the right of blood, rather than just soli, which is right of the soil.
Okay, meaning where you were born doesn't automatically dictate your status.
Right. So even though the citizenship laws had some reforms back in 2000, the Federal Statistical Office still uses definitions that can label you with a migration background, even if you were born in Berlin.
Just because your parents, or like your grandparents, had foreign citizenship at some point.
Exactly. So it takes an actual historical event migration, and it transforms it into this inherited characteristic.
That is wild. It basically creates an administrative subclass. It makes it an ethnic category rather than an experience.
Yes, and that sociological argument is central here. It sets the stage for systemic othering. It establishes a default citizen versus the other, which bleeds directly into how people are treated at work.
Okay, so with that context, I want you, the listener, to imagine a scenario. Imagine you work in a hospital.
A highly stressful environment.
Super stressful. And you are highly qualified. You have years of experience. You do your job exceptionally well.
You are saving lives.
Right. Literally saving lives. And yet, day in and day out, you were treated differently than the person standing right next to you in the exact same scrubs. Why?
And we have to emphasize, this isn't just a hypothetical thought experiment for the 251 participants in this study.
No, these are real people.
Yeah, these are real professionals, doctors, nurses, researchers, technicians, at 2 massive German university hospitals.
Charité in Berlin and UK in Hamburg, right?
Exactly. They immigrated to Germany, and they are living this exact paradox every single day.
It is like, okay, think of it like running a marathon, but some of the runners are secretly handed a 10-pound weighted vest at the starting line.
That is a perfect analogy. The hidden toll of that dynamic is exactly what the researchers measured.
Because there is this massive societal belief, right? We all want to believe that the healthcare system is a pure meritocracy.
Oh, the myth of pure medical meritocracy.
Right. It's a place of science. It's life or death stakes. The narrative is that only performance matters. If you are good, you will succeed.
But this raises an important question. Does that biological objectivity actually translate to the workplace culture?
And the data says no.
It says a resounding no. The authors introduced this concept called the culturalization of racism.
Okay, break that down for us. What does culturalization of racism actually look like in a hospital break room?
Well, overt biological racism, like using explicit slurs, is mostly taboo in these highly educated environments. So the discrimination hides behind other words.
Like proxy words.
Exactly. Signifiers like culture or religion or nationality. People use these to legitimize socially ostracizing their colleagues.
So instead of saying something overtly racist, a colleague might say, I just don't think their cultural background fits our communication style.
Yes. Or they question if their educational culture taught them the right hygiene protocols. It sounds professional, but it is rooted in deep bias.
But wait, doesn't Germany have strict laws against this, like the The General Equal Treatment Act.
The Allgemeines Gleichbehandlungsgesetz, yes. It prevents formal workplace discrimination.
Okay, so legally, you can't pay them less based on their background.
Right, the legal framework is there. But the lived reality of these workers proves that a law cannot enforce true equality on a human micro-interaction level.
A law can't force your colleagues to invite you to the informal case review over coffee.
Exactly, or force them to give you the benefit of the doubt when a minor error happens.
Okay, so let's look at the actual x-ray of these hospitals. Who are the people in this study?
The demographics are fascinating. The median age is around 35 or 36.
So these aren't right out of school.
No, they are highly educated adults. Over 50% at Charité and 69% at UK completed their professional training before they even arrived in Germany.
So they showed up as fully formed, highly valuable professionals.
Absolutely. They bypassed a decade of expensive state-funded medical education. They are a massive asset.
Which brings up an amazing paradox in the numbers. Because you often hear the stereotype of the foreign-trained doctor who is forced to drive a taxi.
Right, the underemployment trope.
But the study showed something totally different. Only 1 to 2% felt employed above their qualifications.
Yeah, and the vast majority, we are talking 72 to 78%, felt their current position perfectly matched their qualifications.
So the state bureaucracy is actually working. The degrees are recognized, they get the job.
Exactly. The structural integration works. But then they get onto the hospital floor and they hit a wall.
And the first thing people usually blame that wall on is language, right?
Always. Language is the go-to excuse. But let's look at the language data. 57% had some command of German before they even arrived.
And how did that break down by profession? Because that was super interesting.
It's a total inverse of what you might expect. The scientific researchers, the people in the labs, had the lowest German skills.
Right, because international science is basically all done in English anyway.
Exactly. But the nurses and the technologists, the ones with the most direct patient contact, reported the most proficient German skills.
They have to. You can't safely explain an MRI procedure without flawless German.
Right. And yet the researchers noted that the language difficulties these fluent nurses did have weren't with patients.
Where were they?
Mostly in documentation, like charting and on telephone calls.
Oh, that makes so much sense. Charting requires perfect, rigid grammar, and phone calls have terrible audio quality and no body language.
And lots of regional dialects from doctors shouting orders over the phone.
So these highly fluent nurses might hesitate for a second on the phone, and suddenly their competence is questioned.
Exactly. Which leads us to the everyday reality of the discrimination they face.
Yeah, let's talk about the findings, because the most jarring takeaway for me was that this is not an isolated incident. It is a daily occurrence.
It is systemic.
And the shocker is who is doing the discriminating.
Right, it isn't coming from the top down. The data shows only about 9 to 11% experience discrimination from their superiors.
So management is actually mostly fine.
Mostly, yes. The bosses aren't the primary issue.
It's the peers, the colleagues. 31% of non-scientific staff at Charité and 35% at UK felt discriminated against by their own peers.
Over a third. By the people they share a charting station with, the people they eat lunch with.
That is just so destabilizing. It's horizontal hostility. And the patients were doing it too, right?
Yes, about 25% at Charité and 18% at UK experienced discrimination from the patients they were trying to heal.
So they're getting squeezed from both sides. What were the main reasons they cited for this discrimination?
The study synthesizes 4 main drivers: language, origin or nationality, race and ethnicity, and gender.
Let's dig into that gender nuance, because you pointed this out earlier and it's fascinating.
Yeah, the data on gender is so telling. Gender discrimination was cited heavily by female doctors and scientists.
Because they are competing in a historically male-dominated hierarchy.
Exactly. They're fighting entrenched sexism on top of xenophobia. But when you look at the nurses and technologists...
It's a field dominated by women, roughly 73 to 74% female in this study.
Right. So among nurses, gender wasn't cited nearly as much as a vector for discrimination.
Because the peer group is homogenous in that regard. So the dais just shifts to attack whatever is different, which is their origin or race.
Discrimination is opportunistic. It finds the structural differential and applies pressure.
Okay, but here's where it gets really interesting. We just established that the nurses have the most advanced German skills. Right?
Yes, the most fluent.
But they still cited language. as a primary driver for discrimination from their peers.
Exactly. And the researchers ran the stats on this. They looked for a correlation between actual language proficiency and experiences of discrimination.
Wow.
There was zero statistical relationship.
None.
None. Mastering the German language did not shield these workers from discrimination.
Wow. So even if they speak perfect clinical German, the discrimination still happens. It just proves that language is an excuse.
It is the most socially acceptable proxy. A colleague says, I couldn't understand their accent, when what they really mean is, I don't want to work with a foreigner.
This is so heavy. It's an invisible psychological weight. Can we transition from these obvious acts to the underlying mechanisms? How does this structural inequality actually function in their minds?
The researchers measured a phenomenon they call the compulsion to compete.
The compulsion to compete, meaning they feel like they have to constantly prove themselves.
Yes, and the numbers are staggering. 50% of respondents at Charité stated they felt this compulsion.
Half of them.
And at UK, it was 66%. Two-thirds of the migrant staff feel they have to constantly prove their basic competence to their colleagues.
Just to exist at the baseline.
Exactly. Every single shift, they are essentially on probation in the eyes of their peers.
That sounds absolutely exhausting. And it's not just a feeling, right? It manifests structurally.
Yes, it does. 33 to 38% noted unequal opportunities for further training and promotion.
Because if your peers are constantly questioning you, you aren't going to get recommended for the advanced seminar on the new dialysis machine.
Exactly. And around 25% noted a complete lack of equal appreciation for their daily work performance.
Which directly impacts their workplace satisfaction.
It erodes their self-confidence, it stalls their integration, and it ultimately impacts whether they decide to stay in Germany or leave.
Which brings me to a question I want to throw out to you, the listener, and to you. If two people do the exact same job, they wear the same scrubs, they pass the same exams, but one has to constantly prove their worth just to be seen at the baseline. Is that fair?
Well, if we connect this to the bigger picture, it isn't just unfair, it is a massive systemic risk.
How so?
The psychological toll of what the study calls brief encounters.
Brief encounters, like being ignored or treated rudely in the hallway?
Yeah, being overlooked during a handover or someone rolling their eyes at your suggestion. This constant friction burns out the exact professionals the system desperately relies upon.
Let's talk about that reliance, because the macro data in the source is mind-blowing. Germany's healthcare system would collapse without these folks.
Oh, without a doubt. There are almost 49,000 foreign doctors operating in Germany.
And how many nurses?
Roughly 133,900 nurses with a foreign background.
And the COVID-19 pandemic only accelerated that global recruitment, right?
Absolutely. The domestic labor pool is shrinking because of demographics, so they have to look outward.
Which leads to a really interesting sociological concept the text brings up. Antonio Gramsci's Southern question.
Yes. Gramsci was an Italian philosopher. He analyzed how the wealthy industrial north of Italy extracted labor and resources from the poorer agrarian south.
So they essentially drained the South to build their own hegemony.
Exactly. And the study applies this brilliantly to modern global health. The global north places like Germany extract highly qualified labor from the global south, as well as Eastern Europe and Asia.
They drain the talent pool. And they do it by making promises, right? Promises of better income, democracy, better working conditions.
Exactly. They actively recruit these professionals, but the reality they face upon arrival is drastically different.
And we have to carefully note the context the authors mention here. The study points out the growing right-wing populist positions across Europe.
Right. And we are just reporting the text impartially here. The authors frame this political climate as a societal backdrop that massively exacerbates the discrimination.
So the state is desperately recruiting people to come save the hospital system, while the broader societal backdrop is simultaneously telling them they don't belong.
It is the ultimate core conflict. This isn't just about an individual problem with a rude colleague.
No, it's totally structural. You are recruiting people to save your system, and then systematically excluding them once they clock in.
Which brings up the ultimate sustainability question.
Yes. If a system is entirely dependent on migration to function, literally cannot keep the lights on without it, but simultaneously produces discrimination that drives those very migrants away, how sustainable is that system?
It isn't. The researchers note that the fundamental disconnect between the expectations of these migrant workers and the reality of their distress and humiliation threatens the whole model.
So what can actually be done? Can management fix this?
The authors suggest that management-level interventions are crucial. They need to raise awareness among superiors about this horizontal, peer-to-peer hostility.
Because right now, management might think everything is fine since no one is officially complaining about the bosses.
Right. They need to actively monitor training opportunities and build true inclusive structures, not just rely on a piece of paper that says we don't discriminate.
They have to actively dismantle the culturalization of racism on the floor.
Exactly.
Wow. This has been a really intense, eye-opening deep dive into the Empower Migra mission.
It really highlights how complex these issues are beneath the surface.
Because remember, understanding begins with listening. We have to listen to the data, and we have to listen to the lived experiences of the people keeping our hospitals running.
We can't just rely on our comfortable assumptions.
Exactly. And I want to leave you, the listener, with a final, lingering thought inspired by today's text.
A little something to mull over.
Right. We saw that highly qualified migrants who already speak excellent, fluent German are still facing intense peer-level discrimination.
The statistics were clear on that.
So does the classic integration advice of just learn the language and assimilate actually work?
Or is it something else entirely?
Exactly. Is that advice sometimes used as a moving goalpost?
Yeah.
A way to preserve structural inequality by constantly demanding the migrant prove themselves over and over while the rules keep changing?
It's a powerful question. It really invites us all to observe the power dynamics in our own workplaces.
Take a look around your own office or break room this week. Watch out for those moving goalposts. That's all for today's deep dive. Thanks for listening and stay curious.